Hi guys, welcome back to another video of Visual channel. So today we will be telling you detail about the Enrofloxacin injection and Mifex. So we have been very familiar with the Enrofloxacin since we have been dealing with the clinical cases of any bacterial infection or any general systemic circulatory defaulting problems. So we are also familiar with the Mifex, that is calcium borogluconate. Also, magnesium is contained in Mifex. So it's a mixture of calcium and magnesium, and enrofloxacin is actually a fluoroquinolone antibiotic. So never mix them together and give to the animal in a single case. So there will be some problems associated with the structural activity relationship of enrofloxacin. So if you haven't subscribed this channel yet, feel free to subscribe and hit the bell icon for more updates. So this is actually the enrofloxacin injection, and this is the calcium magnesium borogluconate injection, that is Mifex. So both injections are very familiar in case of large animal practices, and we used to give this enrofloxacin injection as the antibiotic injection because it's containing the broad spectrum antibiotic enrofloxacin, and they mainly belong to the class fluoroquinolone antibiotics. So this is actually the fluid which is mainly used in the fluid therapy. That is in case of downer cow, the hypomagnesemic tetany, grass tetany, or in case of milk fever also. So they belong to fluoroquinolone antibiotics. So bactericidal agent, and the mechanism of action you can see, that is inhibition of the bacterial DNA gyrase, that is type 2 topoisomerase enzyme, thereby preventing DNA supercoiling and DNA synthesis. And you can see what the properties of the enrofloxacin. And this is actually the basic properties of enrofloxacin. This is actually a picture taken from the Bugs Veterinary Handbook, and should not be used in humans actually. This is only restricted to veterinary practices, and there will be many drug interactions, and IV administration can potentially be very risky in small animals. But there are also some very special IV preparations in case of this thing. And in dogs, oral bioavailability is better than ciprofloxacin. So the fact is actually injectable enrofloxacin must not be mixed with or come into contact with any of the IV solution containing magnesium. Why? Because microprecipitants will be formed and they will lodge in the lungs. That is actually when magnesium reacts with the enrofloxacin. Due to some special properties of enrofloxacin, the magnesium get bonded to the structural activity relationship of enrofloxacin, and they precipitate, and these precipitate are microprecipitate, and they get occluded inside the vessels, and they may create some pathological affections in the lungs, and that will lead to the bronchospasm, bronchiectasis, dyspnea, and the animal will be showing respiratory depression and many respiratory problems soon after the combined injection of magnesium and Mifex or enrofloxacin. So never give them together. If at all you want to give, first of all you can go for enrofloxacin shot, and after a time duration like 8 hours or 16 hours, like you have to go for either you have to select a different antibiotic or you should have minimum time gap. So never give them together. Thank you.